One of the most common questions that I receive is what to do when my pet ingests something poisonous. So there are many considerations to think about when trying to answer this question. The first and most important thing is whether the substance that was eaten is caustic or not. So by saying caustic, I mean that it's something that will damage the esophagus when it's vomited back up. So in the cases that this happens, if a pet ingests something such as an acidic substance, gasoline, or bleach, then we do not want to induce vomiting. And if you don't have access to a veterinarian, you need to soak bread in milk and then feed 3 or 4 slices to your pet. This will actually help absorb the toxin and help pass the GI tract in a quicker fashion. Also, like I said, we need to go to a veterinarian in this case, and they would administer activated charcoal, which would further help absorb the toxin and help prevent damage as it passes through the intestinal system. The second thing, if your dog ingests something such as chocolate or antifreeze, something that's not going to cause damage coming back up, then in that case we want to induce vomiting. So once again, the most ideal thing is to go to your veterinarian's office. Even if it's after hours, they have better things to cause vomiting than hydrogen peroxide. But in the case that this can't happen, then I have actually included hydrogen peroxide in the kit. One thing to note is that it's 3% hydrogen peroxide, and anything stronger than this will actually cause damage to your dog's stomach and esophagus. So with the peroxide, we go ahead and the guidelines that we use are 1 ml, which is equal to a cc in a syringe, per pound of body weight. We do not want to exceed over 60 milliliters at one time, and we can actually repeat this in about 15 minutes if the pet does not vomit with the first dose given. To make your dog vomit with hydrogen peroxide, we go ahead and drop the required dosage, and for instance, if we have a 25-pound dog, we drop 25 cc, so it would be equivalent to 2 syringefuls of this size. So we go ahead and administer this orally. We just hold their head and make them drink it, and just give it to them slowly so they don't actually suck it into their lungs and aspirate on it. So make sure they're actually drinking it. And after the required dose is given, go ahead and place your pet into a kennel or like a bathroom, somewhere they can be by themselves, because I found through my experience that pets will vomit more readily when left alone versus when they're watched by their owner. Another important side note is if they do vomit, get them away from the vomit immediately, because pets have been known to re-eat what they've just vomited up and then poison themselves again.